Om Swastiastu. Hello, Dr. and all my friends. Today we are from SGD 3. We're gonna present about our student project, Testicular Feminization Syndrome. So here's our member. My name is Jeremy, with student number 083. I'm gonna explain about the background. Testicular Feminization Syndrome is a genetic variation of male pseudohermaphroditism. These patients have a normal male karyotype and negative sex chromatin. Testicular Müllerian inhibitor factor may be present normally, whereas the testicular Wolffian duct stimulator may be totally lacking. The phenotype ranges from normal female external genitalia in the complete form or CAIS to normal male external genitalia associated with infertility and or gynecomastia in a mild form or MIES. A large spectrum of undervirilized male external genitalia is observed in the partial form or PAAS. So here's the formulation of problems and the purposes of our student project. So the benefits of our student project. The benefits of this paper is to improve our knowledge, deepen our understanding about testicular feminization syndrome, and more importantly, it also can be used by the next researchers as supporting theory in order to resolve the problems related to testicular feminization syndrome. Thank you.
My name is Putri Pranyani with the last number 222. So testicular feminization syndrome or androgen insensitivity syndrome is a disorder of hormone resistance which stop the forming of the male genitalia and give a female phenotype that happen as a result of various abnormalities on X chromosome that lead into a resistance to the action of androgen hormone. So it can be divided to a complete androgen insensitivity syndrome, partial androgen insensitivity syndrome, and last is mild androgen insensitivity syndrome. So this androgen insensitivity syndrome was classified as a rare disease that only occur in 1 out of 65,000 births in the world. Thank you.
Hello, good morning. My name is Lalita Samala with student number 156 and I'll tell you about the etiology of testicular feminization syndrome. Testicular feminization syndrome, or more commonly known as androgen insensitivity syndrome, is a rare disorder when a male with 46XY karyotype has a female appearance. This clinical presentation occurs because of the mutation in the coding sequence of the androgen receptors. It will lead to dysfunction and malformation in the androgen receptors gene and hormone resistance, ranging from the loss of receptors on the cell surface due to incomplete protein synthesis to change in substrate bone affinity. After that, it triggers the loss of the signal transmission. It means that the testosterone will not have any effect on the body, partially or completely, even though having functional testes and enough testosterone production. Thank you.
My name is Yusan Alim, student number 149, so I will present about pathophysiology of testicular feminization syndrome. The first one is mutation in AIS cause androgen receptor or AR synthesis signaling to be impaired. This difference in AIS cases are highly visible in the distribution of strength of hormone or receptor affinity, which affects several stages of male, important role in sexual differentiation, spermatogenesis, secondary male features, and also feedback regulation of gonadotropin secretion. The second one is in AIS, hormones are not able to bind to AR. As a result, wrong development will occur in the male reproductive system. The testes are often retained in the abdomen or in some cases and sometimes the location of the testicle found in labia major. The third one is GCY, growth controlling gene, which is located in the Y chromosome, causes a height above the average for women. In some cases, mutation can cause severe clinical manifestation of AIS occur with complete androgen insensibility, which is characterized by a fully developed feminine phenotype in the presence of normal external genitalia, labia, clitoris, and vagina. Thank you.
Okay, thank you. My name is Krishida Vaniapson with the last 3 digit number are 118. I will explain about risk factor testicular feminization syndrome. Testicular feminization syndrome is an X-linked recessive genetic disorder that causes androgen resistance. The syndrome is associated with increased risk of testicular germ cell tumor or TGTC. One of these predisposing factors in TGTC development is the prolonged presence of pluripotent germ cell gonocytes that lead into maturation delay of germ cells. Germ cell tumor also can influence by chronological age and gonadal location, residual paracrine actions of androgen in testicular tissue, genetic susceptibility, and mutation of androgen receptor gene and protein. Thank you.
Thank you for the time. My name is Josali Mantaho with 3 digit student number 035. The molecular pathogenesis of testicular feminization syndrome or androgen insensitivity syndrome or AIS begins during the sexual development. In normal conditions, the AR proteins in our body will bind to the androgen response elements and regulates androgen responsive gene expressions. On the other hand, when mutation occurs or AIS occurs, mainly these mutations are missense mutation and point mutations. In the pathogenesis of AIS, when the mutation occurs, cell response to androgens or DNA bindings are impaired and therefore limits the androgen responsive gene expression, leading to androgen resistance, or we could say AIS, androgen insensitivity syndrome. Thank you.
Hello, my name is Bulan Arda Putri, my number is 010, and here I'm going to explain to you about the clinical manifestation. So the clinical manifestation that could arise through AIS pathogenesis could be classified into either complete or partial androgen insensitivity syndrome. So anatomically, individual with complete AIS, or known as CAIS, have female external genitalia ranging from normal labia, vaginal introitus, and clitoris, while individual with partial AIS, or known as PIAS, have milder changes ranging from mildly undervirilized male external genitalia to mildly virilized female external genitalia. So in both forms, affected individuals still have normal testosterone productions and normal testosterone conversion into DHT, even though it will be located intra-abdominally. Thank you.
Hello, my name is Nicole Kuntario Paramana Putri with last digit number 065. I will explain the diagnosis. So, the diagnosis of testicular feminization syndrome or complete androgen insensitivity syndrome (CAIS) can be diagnosed in intrauterus at birth, childhood, and puberty. The syndrome can be diagnosed in three scenarios. The first scenario is diagnosed in fetal life when prenatal sex determination discloses a 46XY karyotype with female genitalia external. This scenario can be done by determining karyotype from the amniotic fluid and then using ultrasound to verify the genetic sex. The second scenario is a girl in childhood age with inguinal hernia, and the last scenario is at puberty. CAIS can be overlooked at birth and diagnosed at puberty when the patient comes with amenorrhea. Thank you.
Hello, my name is Cliff Christopher Yongasa, student number 172. I'll continue the presentation. The next step for the patient with amenorrhea is determining blood level of different sex hormones. In this case, androgen insensitivity syndrome is characterized by elevated testosterone and serum LH. The clinical examination of CAIS shows a short vagina and by imaging technique shows no uterus and ovaries. Differential diagnosis of testicular feminization syndrome are Mullerian duct abnormality, complete gonadal dysgenesis, and Mayer-Rokitansky-Kuster-Hauser syndrome. A rare differential diagnosis is biosynthetic enzyme deficiency.
Hello, my name is Jonathan Edmond with student number 137. AIS prevention can be done by prenatal tests on mothers with a high likelihood of carrying pathogenic variant in their family gene and also carrier tests for risk relative. For the surgical treatment in CAIS, patient deciding when to perform the surgery is crucial. Early gonadectomy could prevent tumorigenesis. However, gonadectomy could also be postponed until the patient enters adolescence if there is no risk of developing gonadal tumors. Apart from gonadectomy, vaginal dilation and vaginoplastic procedure also requires. While for patients with PAIS condition in individuals identified as female, early gonadectomy and genitoplasty is also recommended. In male patients, surgical procedures to correct cryptorchidism and hypospadias must be done immediately. Usually, at puberty, patients develop gynecomastia that requires another surgical treatment. Thank you very much.
Hello doctor and friends, my name is Cynthia Sudana with the last two number 233. I'll be continuing the presentation for the second management, which is hormonal therapy replacement or HRT. HRT are done after surgery procedure to prevent symptoms of hypoestrogenism, inducing pubertal development and to maintain secondary sexual features. For CAIS and PAIS patients that identify as a female, the initial HRT are estrogen therapy, while for the PAIS patient that identify as a male, the initial HRT treatment are testosterone and dihydrotestosterone therapy. And for the third management, which is psychological counseling, doctor will aid the patient and also provide support groups for the patient and their family. Thank you.
Hello, my name is Dani Prema with the student number is 182. So next I want to explain about the complication and the prognosis of testicular feminization syndrome. So if the testicular tissue is not removed, it is known to have several potential complications. The complications that can occur are the testicular cancer, infertility, and psychological disorder. The prognosis depends on the severity of genital ambiguity, the appropriate medical and psychological care, and with the appropriate treatment, it can lead to an active life with normal sexual functioning and psychosexual development. Thank you.
Okay, my name is Maria Parmasi Sabria Fernanda with student number 102. Now I'm going to read the conclusion of this paper. Androgen insensitivity syndrome, or AIS, formerly known as testicular feminization syndrome, is a disorder of hormone with resistance which stop the forming of male genitalia and give a female phenotype as a result of various abnormalities on X chromosome, leading to resistance to the action of androgen hormones. Divided into complete androgen insensitivity syndrome, or CAIS, partial androgen insensitivity syndrome, or PAIS, and mild androgen insensitivity syndrome, or MIS. Diagnosis can be made by examination on amniotic fluid and ultrasonography during fetal life, or at puberty age where estimation comes with amenorrhea. Management of androgen insensitivity syndrome are surgical procedures, hormonal therapy, and counseling. Thank you.